Anybody that has chronic illness, that patient is a house, and that house has now burnt to the ground when we have chronic illness. And what we're doing is we're so quick to go in and put all of these things into the body and rush to rebuild. We haven't taken a step back to do two critical things, and that's to identify the source of the fire and then clear away the rubble. We have to do those things first in that order in order for any other treatment to really take hold and create change in the body. Once I realized that, I stopped everything we were doing. I detoxed my son, only using ion detoxification for him for 8 months. And I really am excited to tell you that my son is recovered. So why is ion detoxification so different? How can this tool help utilize healing in a body, help facilitate detoxification and change your patient outcomes? What I learned is that when it's done properly, what we're doing is creating a frequency that's harmonious to the body so that we can elicit a relaxation response. The goal of that is then to activate the parasympathetic nervous system and create rest and digest. Rest and digest is the body's innate process to be able to open up those pathways and release everything that the body can't utilize, whether that's toxicity or if it's built up nutrition that was meant to help us but now we can't use it. That's the system that we use to move those things back out of the body and create homeostasis. So the purpose of ion detoxification is to facilitate that as an external proxy where the body is compromised and cannot do it on its own, even when you've already done other internal interventions that are not working. So, and that's really what it is. It's quite simple. It's when you think about in terms of being able to access these frequencies that help our body come back into balance. We're looking for grounding. We're looking for being able to create homeostasis in a way that we can't do on our own anymore. This is what it's doing. And so I think what I've seen in my clinic is quite profound. Patients that are the ones that are non-responders are often the ones that respond the best to ion detoxification. It also does something, the true magic of it is that it's creating detoxification systemically. Once we activate rest and digest and we're working inside the natural system of the body, all the organ systems have the potential to become detoxifying. So what we don't see in the water is okay because the colon may be cleansing, the liver may be cleansing, the blood system may be cleansing, maybe the respiratory system is now being activated. These things that we don't necessarily measure in the water, we know are occurring inside the body. We do baseline labs at my clinic that tell us where the metals are and where the organic acids are, and then we cleanse for 4 to 6 months with that patient and retest them. And I can tell you, we are seeing clinically significant results just using this tool. So it's definitely an effective answer for those that cannot facilitate these processes on their own. One thing that I have also noticed is that over time, we'll need to do less and less sessions as the body relearns its natural process to activate parasympathetic nervous system on its own. But I can tell you that patients who didn't have any hope before, who've done every intervention, they've gone to every practitioner they can think of, they've tried all of these tools and they can't seem to facilitate that healing, and then they begin using an ion detoxification system that works inside the energetic pathways of their body, that helps work with the natural system that it was given at birth and help facilitate that. The outcomes that we're seeing in the clinic are very significant. These patients are finally starting to feel better. And when they feel better, that treatment that we're doing with them that wasn't as powerful or wasn't as effective before, once those pathways are open and clear, all of a sudden that treatment actually does become effective for them, because now their body can utilize those things that we're giving them effectively where it couldn't previously. And really that's the crux of it.